You have a presentation?
No, no presentation.
No problem.
Thank you for having me here. Thank you for taking your time off today to come and listen to me talk. I had a presentation for about 45 minutes, but I doubted that Minerva and Todd would let me present that for 45 minutes, right? And you guys would be bored anyway, so I decided to make it very short. My names are Joseph Odanga, and currently I'm an executive director with Helping Hands International Foundation. Helping Hands International Foundation is a 501c3 non-for-profit organization that's geared towards helping people in the third world countries to obtain equal access to education and healthcare. All of you probably remember our parents telling us, you know, we have it so easy and they had it so hard. And I used to ask them, Dad, really? Well, my dad, when he was growing up in the 1940s, 1930s in East Africa, Kenya, from the stories that he gave me, he would have to wake up early in the morning, go to the farm, then come home, prepare to go to school, and if he didn't finish his chores, he couldn't go to school. Kids today, they have no idea what a farming is. Most of them actually don't have an idea what a farm is. So, and going to school is almost like a right, which is very good for the kids. Education is always important. As for healthcare, when he got sick, he would talk to his parents, and his parents would go out in the bush somewhere and get the local traditional medicine, roots, sparks, leaves, boil them or prepare them however they prepare them, and he would take that as medicine. Any major ailment, he'd have to walk for days. Most people actually would have to walk for days to try and get access to the missionary facilities that had health care. And then when you got there, you'd have to wait for a few more days to even get treated. So out here, a lot of people look at the healthcare services that we have and they say, well, it's not good enough. And I could agree, but other people don't have it. Okay, so we have it, they don't have it. It's not good enough for us, and I'm pretty sure most people would be, when they see the healthcare services and the doctors that we have around here, they'll be so amazed at what we have. Just a small story. I was getting ready today, and I was wondering what tie to pick. I was wondering yellow, red, pink. And I kept asking Delilah, which one do you think is better? And she just stood there, sat there literally, and true to fashion, didn't say nothing, wagged her tail and walked out. If she spoke, I'd probably be devastated to hear what she thought of me asking her every day, what do you think, what do you think? So, not too many developing countries are fortunate to have what we have. So the reason why I wanted to make this presentation, and Minerva wanted me to do this, and I thank Minerva and Todd, is to give you guys a different perspective from what we're used to. If you're used to something, or if you have an issue, your issue is the biggest one than your neighbor's. And your issue could be a major issue, but your neighbor's could be a small issue. Their dog is not house trained, but that's a big issue for them. So each individual person have different issues, and as a country, when it comes to healthcare, are suffering compared to what we have. Helping Hands is working with East African countries, and especially in western rural Kenya, to build clinics. And these villages have to walk 15 miles to try and go and get healthcare services. Literally walk, because they can't afford to pay for transportation. There's a few cars that run by on the paved roads, and when it rains, it's almost impossible for anybody to get access to those roads or the cars to come. So they'd rather save that money and use that money to pay for the consultation services. And these consultation services, you pay first before you get any services. If you don't pay, you don't get any services. You know, go and find a root, a bark, a leaf, or whatever traditional medicine you can find and try and cure yourself. Or talk to the traditional doctors to help you. In case you have a major ailment where you need to go to a hospital, there are hospitals, but you have to go 60 miles to get to a mid-level hospital. And when you do get to the hospital, it's the same process. You have to pay first, and then you get the services. So you go in the hospital, maybe you don't have all the money, you have a deposit, so you pay them, they see you, they treat you, you get admitted. Before you're released to go home, you have to come up with a difference. If you don't come up with a difference, the facilities actually hold you in the facility before they can let you go if you don't settle your bill. So literally, some facilities don't even let you out of the door for sunshine if you don't pay your bill. Okay? In case you die, God forbid, they'll hold your body until your family settles that bill. And sometimes they won't even let access, they won't give your family access to see the body until you pay a portion of that bill. Okay? Here in the United States, that's called jail. All right? Or kidnapping. You can't do that. So people have it really, really tough out there. And it's a tough life. We are currently working, when I say we, the administration and Congress, they passed the healthcare bill, which is a good start, to allow everybody access to healthcare. Every single person, including people with pre-existing conditions. And I'm sure it's not the best bill that there could be, but it's a start. Okay? You can't give birth to a child and expect them to be an Olympic sprinter. They have to crawl, then they have to try and stand and fall. Sometimes you'll catch them before they can walk, and then they'll start running, and then they can become an Olympic sprinter. So it's a good thing that we're working towards that, and we should consider ourselves very fortunate because a lot of people don't have what we have. And another thing, now that I disclosed that my father is from Kenya, I'm not expecting anybody to ask me for my birth certificate. Thanks, guys. Thank you for listening to my presentation.